How brain laser has been shown to have really profound effects on the brain of a child with autism. So there is so much cool research data that's coming out about the effects of laser therapy on the brain of children with autism and other different types of neurodevelopmental disorders. And so in this video, I'm going to spend some time breaking down for you some really cool data from one of the studies here that I've recently been doing quite a bit of work with, because in our practice, you may have noticed that a lot of folks here are getting laser for their brain. If you don't, it's a really, really neat, novel, powerful, and safe tool to improve function of the brain in a safe, no side effect, no danger way. And I want you to kind of get an idea as to what this is, because if you're not familiar with laser therapy, and if you're new to our page, do me a favor, drop a like down. If you're on YouTube watching this, do me a favor, hit the subscribe button, because lots more of this content is going to be coming out. Laser therapy is something that we did in our practice for a very, very long time. We've been open for almost 11 years, and we started doing laser therapy here for pain-related and healing conditions almost right from the very beginning. Over the course of the last 2+ years, though, we started doing laser therapy for brain-related conditions. And it was really and truly kind of by luck, because we had a patient who I was talking to as we were getting ready to purchase our brand new Sumus laser. And she said, "Hey, have you guys ever done laser on the brain?" I said, "No, I don't know much about this." She said, "My daughter had laser therapy, class 3 laser therapy years ago. And she said it was really a big improvement in her quality of life. We saw a really big stage of gains when she was getting this done." So I said, "No." I said, "But I need to look into this." And I thank her so much because it opened Pandora's box. It literally showed me this whole new world of things that we were able to do for brain function. And one of the first studies I came across was this study on children with autism. And if you have a child that is on the autism spectrum, this study I think will be very powerful. But even if you have a child that is dealing with stress and anxiety related behaviors, this is powerful, because what the study outlines is some really massive improvements in behavior and function as a direct result of getting laser directly over the brain. Now, let me step back and talk about laser. So lasers like we use, right? We use a class 4 laser, which has 4 different wavelengths. And the general gist of what they do is they bring infrared and near infrared laser tissue, or laser beams, into the areas of the brain that we stimulate. And what it does, it increases energy, it increases metabolism within the tissue, and it increases stimulation of the tissue. So they're getting more blood flow, they're getting cells and that start to get fed in a way they haven't become. And the effect of it is improvement in changes in brain function. And the great part about it is that they are sustained, lasting changes, as is documented in the research study that I will share with you here in a moment. And this is super important because, right, when you look at obviously a child on the spectrum, every parent is looking to do anything they can to improve quality of life when there are severe issues with behavior. One of the interesting things with this study is it showed that the children in the study had gains that outlasted the time frame of the treatment time. Now, we've been doing this here, and we've seen extremely similar effects in children that we work with. Now, we work with kids who are on the spectrum. We work with kids that also have things like seizure disorders. So we implement this kind of broadly. We work with all different types of neurodevelopmental conditions. And when we've lasered children who have these neurodevelopmental challenges, we've seen really big improvements in behavior. We've seen really big improvements in function. We've seen really big improvements in things like frequency and severity of seizures and the recovery times, all of those things. So when we look at this study here, I want to go and spend time on one small aspect of it that is very tangible, because the behavior components, when you break this down, the changes were huge. So I'm going to flip screens here, guys. I'm going to show you the actual study so you can see this, because I think once you look at the data points, it becomes way more interesting, because there's so many really cool pieces to this study that I want to break down for you. Okay. So let me go through here. I am going to switch my tab, get this article pulled up for us so we can look at this. And guys, I hope that you see as much powerful data points from this as I do, because when I saw this, I was just quite literally blown away by this. All right, so let's go ahead and we're going to pull up this window. right. And I'm going to share my screen and we're going to go into this document. Oops, not that one there. We're going to switch over into this document here. All right, guys. So this is one segment that I really think is important for you. So this was a 40 participant study. Okay, so 40 kids segmented into 21 and 19. Okay, and the section that we're looking at is what's called a clinical global impressions improvements change subscale. This is a big deal because what they were looking at is behavior change. And what they did on this is they plotted out the change over time. So a couple of things I think for you to keep in mind is that when you look at the way that this study progressed, okay, the placebo group, right, did not receive any laser therapy. But what they showed in the kids who got laser therapy is there were really big progressive improvements. And what's interesting is if you look at like these changes, right, they showed that the treatment group, they went from a baseline that was, either static at moderate to severe behavioral issues, where you see on here, you've got these kids who had really significant behavioral improvements. So where 4 of the kids showed very much improved, 13 kids much improved, minimal improvements, only 3, and no change in this group in 1. But look at this one. What's interesting is that when you get a little further down into these studies here, right, they track it out over time. And what was really interesting is that you look at the time frames. This was only a 4-week study where the kids in this group had 2 lasers per week for a 4-week time span. Now, in the first week, right, for week 2, there wasn't a lot of data, not much change in terms of the very much improved group. But within the first 2 weeks, 9 of the kids already were showing showing much improved. 11 of the kids were showing some improvements. 1 of the kids showed no change. Okay. By the time you're at week 4, 5 kids very much improved. 12 kids much improved. 3 kids minimally improved. 1 kid no change. But look at what happens when you get over to week 8. 10 of the children of the 21 very much improved. 8 of the children much improved. 3 of the children minimally improved. So there was all some level of improvement. Where if you look at the placebo group, all the kids were either no change or worse. This is a huge issue because think about this. If you are a parent of a child who is on the spectrum, what kind of a change this would mean for quality of life. And the nice part about these types of treatments using lasers is that they are non-invasive. There are no negative side effects for your child, yet you can see these kind of positive improvements by lasering the areas that they discuss within this video or within this study. And so when we implemented this here within our practice, we literally modeled lasering the same areas they talked about, and we implemented the exact same levels. So we're duplicating the treatment style they do with our own patients, where we'll always do our first phase treatment at 2 laser visits a week for 4 weeks if a child is having these types of symptoms. If you're coming in for different stuff, all of our treatment protocols for brain are based upon the type of symptoms that you have. So some people need more, where they'll go 3 times a week. Some people only will get 2 because it's what we have in terms of the data points to model the studies and the treatment protocols afterwards. But in either case, if you've got a child that's on the spectrum, and whether we're combining this with chiropractic care or we're doing this alone, so this is what it looks like in terms of expectations, that realistically, that if you have a child that's on the spectrum and that has a lot of issues with behavior, you should expect to see very noticeable changes over the course of 4, 8, and even beyond weeks of care. Okay. Obviously, in our practice, we combine things. We combine chiropractic care because we know obviously the powerful impact the adjustment has on brain function. But you add this in, the effects in the brain are really profound. So I hope, obviously, if you are someone who has a loved one that is on the spectrum, that you understand the value of this type of a study. If this is something that you obviously would like to learn more about, please drop it in the comments. I could be more than happy to share these research articles with anybody who wants these, because this type of data is really profound. It's obviously not a huge population of people, but to see these kind of a results in a small group with no negative side effects recorded whatsoever is really powerful. And the nice part about these laser therapies is that there is no negative side effects. If you understand what you're doing, you are a competent user of the laser, there's literally no danger to your child when having these laser therapies applied. So I love things that are conservative. I love things that get high impact. So I hope that this gives you value so that you can see changes like this in your child. If you have a loved one that would benefit from this, do me a favor, share this, because the only way that we can obviously get the message out to folks that have children that are in need of this information is by you telling them about this. So feel free to share this video. Feel free to tag if you do. Uh, don't hesitate to request the data. I'd be more than happy to go and send anybody that wants these studies all the information over to you so that you can share this with your loved ones or learn more about it for yourself. Because the best thing that we can do as parents is arm ourselves with information and then start to discern. I will tell you that as someone who's been working with these lasers here for more than 2 years and with brain stuff, it's really been amazing the changes that we've seen. And we work with now anxiety issues, we work with ADHD issues, we work with kids with speech issues, you name it, across the board. And everything that we have implemented laser with, it has dramatically improved all of the children that we care for's results in quality of life. So I hope that this was helpful for you. Again, shorter video today, but I hope that this was of great value to you. If you'd like to learn more or you'd like us to do follow-up videos like this, then do me a favor, make sure you comment about those or message us to let us know what we can do to add more value to you. Again, this is Dr. Scott Haggerty. I own Elite Family Chiropractic in North Royalton, Ohio. So if you have questions about anything that we discussed today, you can either contact us right here through social, you can DM us, or you can go to our website, elitefamilychiros.com, to ask us any additional questions that you may have. Okay. All right. God bless you guys. Have a great one. See